Journey to Joy Live, week 3 with Dr. NJoy. That's me, Dr. NJoy. Nina Joy Minna, but I go by Dr. NJoy. I'm the owner of NJoy Life, Living in Full Empowerment, LLC. So I started this business really to put the awareness out there for mental health, mental illness. There's a huge stigma across racial lines, across gender lines, across ages, everyone. And of course, mainly the Black community. I'm Black. I went into this field so that I can help Black people and everybody, of course, but I, of course, focus on Black people. And that's important because July is Minority Mental Health Awareness Month. So it's week 3. And anybody who's on here can ask whatever question they want about mental health. Of course, I'm not your psychiatrist, so I'm not going to give specific medication recommendations, but anybody's allowed to ask any questions, and I'll try my best to answer generally. In general, for anyone who is suicidal and need crisis, I want to say that the crisis suicidal line is 988. Last week, I said 9898 because that number means something personal. So that was on my mind. But 988, don't dial 9898. It's 988. Think about 911. You have an emergency, dial 911. Obviously, you can still dial 911, but 988 is the suicidal crisis line. It's also a texting line as well. So I just wanted to cover that before getting started. So let's see what we're talking about today. Well, last week I had my sister on, and we talked about the misconceptions about mental illness in the African American community. Just in general, a lot of people feel afraid to go seek help, to go see a psychiatrist, a therapist. And it's that unknown of what is it? What's going to happen when I see a psychiatrist? What's going to happen when I see a therapist? And we're human. I think people feel at ease when they finally actually come and see me. I'd like to think that, I'm approachable and I'm just here to learn the person and learn how I can help them. But really, it's a thorough assessment. We ask lots of questions. I ask lots of questions to get to know the background about their development, about their education, about their background, about their family, and of course, about the symptoms and how the symptoms are affecting their life. And, what are the symptoms or the events that led up to them coming. So it's a casual conversation. I know a lot of people are scared to even talk about, or they're not comfortable talking about what's going on. That make you get by aren't working. Once that's not working, once you're not sleeping or you're sleeping too much, you don't want to get out of bed, you're eating too much, your appetite changes, your relationships start to falter, you're not going into work, things not usually what they're for you. Your life is just changing, right? Those are definitely reasons to go in to see a psychiatrist, to seek mental health, to see a therapist. What are the different mental illnesses? I would love to get into that. So depression is something that a lot of people hear about. Is it just sad mood? No. I mean, there's normal ups and downs. You're allowed to get sad. You're allowed to get anxious. You're allowed to get scared. You're allowed to get angry. Those things are allowed. With depression, it's more than just sadness. Unfortunately, there's sadness. There's also not having any interest anymore in the things that used to be interesting for you, right? So like the hobbies, like, oh yeah, so-and-so used to love playing basketball. Now all of a sudden they're just inside the room and isolating themselves and not doing that, right? So the things that used to put a smile on your face are no longer putting a smile on your face. That is what a lack of interest is. In addition to that, like I mentioned before, so sleep is off, appetite is off. There's a lot of thought traps that come with anxiety and in depression. We're talking about depression that comes with depression as well. So that could be like the feeling that you're a failure, the feeling that you're inadequate, guilt, feeling worthless, feeling helpless, feeling hopeless, those feelings, things that, when you really challenge the thought, they're probably not true, right? So those thoughts come along. And then, of course, suicidal thoughts. If you're feeling like you want to die, you're feeling like you want to end it all, that is definitely a sign that help is needed. And there's two types of forms of suicidal thoughts. I say there's passive thoughts and there's active thoughts. So passive thought would be, I want to escape. I want to go to sleep and not wake up again. I want to die. It's passive, meaning you're not going to do anything about it, but unfortunately you feel that way. Active suicidal thoughts would be, I want to kill myself. Here's a plan. And obviously one's more dangerous than the other, but both of them are concerning. So you want to seek help for that. If there's someone that you feel comfortable talking to, that's great. You know, a parent, a child that's an adult, aunt, mentor, advisor, teacher, counselor, whoever's in your life, you know, reach out to them. But of course, that's why it's important to know numbers like 988. Again, I'm licensed in Georgia, so I always we'll be talking about the Georgia resources, Georgia Crisis Access Line. You can look that up, GCAL. That's also another line that you can call as well. So we talked about depression. There's also anxiety. Like I said, it's okay to worry. It's okay to worry about certain things from time to time, but anxiety, generalized anxiety disorder, would be like excessive worries that you can't stop or control. Worries that there's so much worries that you're not able to do your work. You're not getting along with others. You're increasingly irritable. You're thinking about something awful might happen. It's just all of a sudden you're just thinking about that. Some people get racing thoughts with anxiety. We'll talk about that a little bit too with another disorder. But you can get racing thoughts with anxiety because, of course, you know, that's just waking you up. It's thoughts on thoughts on thoughts on thoughts. Some people have panic attacks with their anxiety. Panic attack is when your heart is racing, you are breathing really fast, sometimes choking, shakes, feeling like you're going to die. So panic attacks can come with the anxiety as well. And so it's really important to know that there's therapeutic strategies that you can do with anxiety. Taking deep breaths, that's the most simplest one. A lot of my patients, they do not want to do the deep breaths. They think that it's not something that's helpful. It actually is. When you try it, just like studying for a test and preparing for that test, what do? You study consistently for it. Taking deep breaths, practicing those techniques so that whenever that anxiety-provoking trigger comes, then you're used to, okay, I'm taking my deep breaths. Progressive muscle relaxation is also another strategy for anxiety. So like tensing your muscles and relaxing them. And you go through every muscle group throughout progressive muscle relaxation. So I'm throwing out a little bit, different things. Obviously, as different journey to joys come about, I will be spending more time on certain things, whatever, ends up coming up is what I will talk about. But I definitely want to talk about bipolar. That is a disorder, especially in the Black community, that gets diagnosed too often, but also family members either self-diagnose or they say that their family member has it. And there's this preconceived notion about certain symptoms of bipolar that I want to address. A lot of people think bipolar is, they get angry so fast. 1 minute they're happy and the next minute they're just angry. And then they're back to happy. I mean, if something awesome happens and you're angry and you're back to happy, that's normal. Or if something that's triggering makes you angry all of a sudden, there's some normality to that. It's okay to have changing emotions. Sometimes that happens. Legit bipolar, so it's bi to poles, right? So there's the depressive quality of bipolar and there's the manic quality. I already explained depression. The manic quality of bipolar is when all of a sudden you are not yourself. So sometimes some people might act manic and that's just how they are. That's a whole nother thing. Maybe they have ADHD. Maybe they're just a hyper person. But for someone who has bipolar and they become manic, all of a sudden they have these next symptoms and they're not themselves. And it might last a few days. It might last a whole week, but it's not lasting just an hour. And these symptoms are the racing thoughts, all of a sudden feeling really high, on top of the world, on like you're on a drug. They call that euphoria. So feeling really good all of a sudden, and so much energy that you can't sleep. So much energy that you don't need sleep. So some people go 2 to 3 days, 4 days not sleeping. They're just like, oh yeah, I'm great. I'm gonna write several books. I'm gonna go be the president of like 3 universities. I'm gonna do all this stuff. And they're just like, I don't know why I feel so good. And all of a sudden they crash either into a depression or they just go back to normal. So that's a whole manic episode. It's different for some people. Of course, with mania, you can also get like some impulsivity, risk-taking behaviors. So like getting on the road, driving real fast, all of a sudden, I don't care. I don't need my seatbelt. Or spending your rent money on something, not thinking, not caring, hypersexuality, using drugs all of a sudden. Again, things that's usually not like you. So that's bipolar. And then the other one I want to talk about is schizophrenia, because a lot of people come to me and they say, oh, so-and-so is bipolar, schizophrenic. But that's actually not a disorder. You're mixing two different disorders. So you already know what a bipolar is, as I said. Schizophrenia is not just defined as, oh, they hear voices, they're schizophrenic. You can get voices for different reasons. So let's talk about schizophrenia first. So yes, you can hallucinate, hearing things, seeing things, maybe. Paranoia, but also like some disorganized thought, thinking bizarrely, delusions. Something's just not right. People don't understand what you're saying. So that's where you get the psychosis. I don't like the word crazy. A lot of people say, oh, they're crazy, or I'm crazy, or I'm not crazy. I'm not going to see a psychiatrist. I don't use the word crazy. Last I checked, the word crazy is not in the diagnostic statistical manual. That's the psychiatry Bible, the DSM. Last I checked, the word crazy is not there. I'm probably crazy because I went skydiving. So you can be crazy when you do stuff like that. But people who come see me, that word, there's no word. That's not a word. So you might be schizophrenic. But we don't use the word crazy. I don't use the word crazy. So that's schizophrenia. There's many variations of that. But don't think just because you might be hearing voices that you're schizophrenic. Some people hear voices because they have so much trauma. So trauma is another thing. Life-threatening situations, even natural disasters. I'm pointing outside because it's raining. There's no natural disaster right now, but it's raining real hard. Abuse, neglect, abandonment, being in foster care, a loss. A loss could be a breakup. A loss could be, of course, losing someone due to death. Any types of trauma, something that's life-threatening. And that can cause a disorder called post-traumatic stress disorder. And those symptoms look like sometimes not feeling inside your body, not feeling yourself, dissociating, nightmares, flashbacks, avoiding the topic, avoiding the area you were when you were traumatized, feeling like just like on edge. We call it hypervigilant, like always looking around like, okay, is somebody after me, that kind of thing. So that's post-traumatic stress disorder. Of course, there's other symptoms. But for some people who've had severe trauma, they can hallucinate. Maybe they hear the voice of the person who raped them. Maybe they hear the voice of the person who died. I'm not putting schizophrenia on that person's chart. We need to treat PTSD. We need to treat their trauma. And just because you've gone through trauma or any of these other disorders, well, at least for depression, anxiety, and PTSD, it doesn't mean you have to be on medication. Therapy can treat majority of this. I leave out bipolar and schizophrenia because most people who are bipolar and who have schizophrenia do require medication. And that's okay, but it's what's needed to help them get to a baseline, get to where they used to be before the symptoms. I'll talk about medication in a minute. But why mental illness? Is it a genetic thing? Is it my family? Is it my environment? Why? Why do I have a mental illness? People might ask. It's all of the above. It's not just one thing. Even for people who've had a trauma, maybe they also have family history of people who have bipolar, who have schizophrenia or depression or PTSD, and it increases their chances biologically of having that disorder. So genetics, sure, family history, the impact of what happened when mom was pregnant, medications or substances used in utero exposures, as we call it, that can increase the likelihood of some types of mental illnesses, however the development was. So, like I said, trauma, in the environment, moving from different places, having to live out in shelters, homelessness, financial issues, any types of stressors. Stresses when mom is pregnant can increase the risk of mental disorders too, or developmental disorders. So I'm talking about the most common ones here. There's so many other ones that can be talked about, but let's get into the medication, because I said that if you're schizophrenic or if you're bipolar, then more than likely you're probably going to have to be on medication, and more than likely on medication for the rest of your life. Medications do have side effects. Most of them are pretty tolerable, the side effects. You have to weigh your risk and benefits when it comes to medication, and talk with your physician, talk with your psychiatrist about it. Don't ever stop a medication because of a side effect. You should talk, because there's always another medication that can be helpful. Because the risk in stopping medications, that increases your chances of relapsing into the depressive episode or that manic episode that you had, whatever the reason you're on a medication in the first place. So you don't want to end up in the hospital. But at the people end up in the hospital sometimes when they need to, when treatment isn't working or whatever they're doing on the outpatient basis isn't working. So hospitalization sometimes is necessary. For people who have depression and anxiety, medication may not be needed for the rest of your life. Like maybe the medication is there to help with you to be able to open up in therapy until you're able to get the coping skills necessary. And then once you're off the medication, you could just use therapy. So it doesn't always mean that. But like I said last week, I always refer people to therapy first before just throwing a medication, because maybe the therapy works without the medication. So yeah, that's my spiel about medication. I'm not going to bore you too much on the details of medication. Of course, once I get more people watching, then I'll go into those details, especially if there's questions. But definitely talk to your doctor about these types of things. And but I'm here too, for questions if you don't have a doctor. Speaking of which, so as I start to have this presence in social media, I didn't think I would ever get to this point, but this is where we are, the world of social media, and it's such an easy way to reach out to people. So I've been looking up different mental health groups, mental wellness groups, support groups on Facebook. I'm not going to name the groups, but there's a lot of these groups. And a lot of people, like some groups have 150,000 people in this mental health and wellness support group. So I was looking at them, and most posts are, I'm sad, I'm anxious, I'm having this panic attack. What should I do? I even saw a post where someone said they were suicidal. And there were people responding to these posts, giving advice. Some of them professionals, but for the most part, the everyday person giving advice. And the suicidal, well, actually with everybody, but especially the suicidal person. And this was like an old post. It was like 7 hours old. So I don't know what was going on at that point. But people were offering their inbox. They said, I just sent you an inbox. Reach out to me. Send me a message. So it's like so many people are around on social media helping each other, because they're there in that support group because they need to help, and they're there helping others. So wow. For people who don't have access to psychiatry or for therapy, it's nice that it's there. But of course, I want to encourage everyone to make sure you do see a mental health professional if you do need it. And you can use your insurance card to look on the back of the card. Look, there's a number there. You could call, or when you sign in, most insurance companies, if not all, have an online presence. You sign in and you can find a provider within network. There's actually on my website, I don't have to rehash all the resources because it's on my website. Go to my website, www.drnjoylife.com, and under frequently asked questions, I do have some resources. That's for Georgia. But some of those resources can help with everybody, like therapy for Black girls, Psychology Today. Those are some. So yeah, I can ramble for forever about mental health, but I think that's really what I wanted to talk about today is what is mental illness. So hopefully you've learned about depression, anxiety, post-traumatic stress disorder, bipolar, and schizophrenia. That's a lot of disorders. That's my drive-by lesson on those. I wish I could take questions, but there's only one person watching right now, and I'm pretty sure that's my husband. Thank you, hubby. He's so supportive. But I know more people are going to see this afterwards, because that's what matters. So you find me on Facebook under NJoy Life, Living in Full Empowerment LLC. You can find me on Instagram under dr.enjoy.life. You can find me on YouTube under Dr. NJoy Life, MD. I love doing this. I'm going to keep doing this every week, Thursdays at 7, Journey to Joy Live. This is week 3. Thank you for watching. Yay.